Good morning, Dulce. My name is Arnold Iglipa. I'm your manual Oshipa today. Can I get your consent to do the treatment and assessment?
Yes.
Okay. So the first, since I've taken you a while ago, your blood pressure, which is 3 times. So your blood pressure is okay, 120/80. Okay. The first assessment, you're the supine position, please. Okay. So the first assessment, listening station, it's heel of the feet. Okay, heel of the feet. Looking for widening or narrowing, flexion and extension. There's no asymmetry. Next assessment is dorsum of the feet. Okay. Same thing, looking for extension and flexion, if it's narrowing or widening. Widening, it's the quality is not really fully extension, like there's something wrong on the left. It's rate number 1 out of 3 extension. Okay, next is sin or ankle. Same thing, looking for flexion or extension. Only 5 grams the pressure. Okay. It's fine. Next is thigh. Okay, thigh. Looking for symmetry, looking for quality, amplitude, and rate. Everything's fine, no restriction. Next assessment is ASIS. On the left side, it's uneven. The rate is 1 out of 3 extension. Next is lower ribs. Okay, between rib 7 to 10. Okay, rib 7 to 10. Okay. Only 5 grams pressure. Okay. Quality is okay, no symmetry. Rate is 3 out of 3. Next is shoulders. Can you move up, please? Move. Can you move up? Move a little bit. Thank you. there's a symmetry on the left side. Flexion rate 1. Okay. Next assessment is bolt hold 1. So my palm is on assessing for tentorium cerebelli. So assessing my palm is like on the parental and temporal. Okay. It's normal, nothing. Symmetry. Okay, next is bolt hold 2. So assessing for flux cerebri and flux cerebrum. So my palm is on the frontal and the occiput. Okay, my palm is like under the occiput and my is like frontal. Okay, clumsy motion. Okay, but still looking for flexion and extension. Okay, it's all good. No symmetry. Rate is 3 out of 3. Okay. Next is bolt hold 3. Assessing for spinobacillar synchondrosis joint. It's my palm. It's sphenoid bone and occiput. Okay. No symmetry. It's good. Okay. 8 out of 3. Okay, everything's okay. There's no symmetry. So now, since we found it like those you at least we found it like you have something wrong in your tightness of your muscle, which is affected like traps, rhomboids, ECM, and pectoralis major. So the first treatment is global. So we call it dural tube. So the first assessment in treatment is occiput. So mostly I'm gonna do is like traction of the occiput, only 5 grams. Okay, looking for fascia restriction, and then there's a restriction. Okay, pulling the superior. Okay, and then there's a restriction going to the vertebral. Okay, next is like sacrum. Okay, so can you lift this one, please? Okay, can you move in your butt? Okay, so my under palm, it's on the L5 to S1. Okay, one is intact. Okay, looking at the fascia, and then this one, it's on the ESIS. Okay, like something like clumsy motion. Okay, and then found, and then erase the restriction, and then fraction this one, the sacrum going inferior. Okay, can you lift this one? Okay, okay. So that there's a treatment for the sacrum and the occiput. We call it like a rock and gliding. So rock, it's mostly like something rock, like nudging. Okay, okay. Rock, and can you lift your glutes, please? Okay, okay. So yeah, so my palm, it's like an occiput into the sacrum, something like rocking. Okay. Next is gliding. So gliding, something like, okay, going to the extension. Hold that. And moving to the flexion. Waiting for the rhyme in nudging. Okay. This is global treatment. Next is local treatment. Local treatment. So first is like thoracic inlet. Okay. So my palm, my under palm is like in the C6, C7 to T1. Okay, can you lift this one? Okay. And my other palm is on the clavicle and the monobrium. Can I get the concept?
Yes.
Okay. So only 5 grams. Looking for the fascia. Okay. And follow the direction. The fascia. Extension. Going to the flexion. Extension. Okay. This is a thoracic inlet. Next is like lumbosacral decompression. So my palm, under palm is like on the sacrum. Can you lift your back, please? In your glutes. Okay, on the sacrum. In my other palm, it's on the pubic symphysis. Okay, can I get the consent?
Yes.
Okay, this one. Okay, can you remove your? Okay, this one. Okay. Looking for the fascia, just to make sure you're intact, your palm into the under the palm, and then glide. Extension. Okay. Thank you. And last treatment, it's focal. So focal is like assessing for the cranial bone. It's assessment, okay? It's for the frontal. So can you remove your sunglasses, please? Okay. So now, so my ring finger, it's on the dent. Okay. The dent. And then on the dent, and then intact first the fascia, and then push a little bit, just 5 grams to the bone. Okay, when it's intact to the bone, and then straight pull your finger to the superior. It's like a magnet. This is parietal lift. Now we're going to reassess. So I'm going to reassess your the first is global reassess. Okay, occiput first, which is dural tube. Can you lift your back? Reassess. Okay, and down, and straighten the legs. Okay, now everything's following good. Okay, Next is left lumborosacral. Can you up your hand? Sacrum, okay, down. And so now reassess the thoracic inlet. C7, 7 to T1. This one. This following good. Last it's assessing for frontal bone. So now, Dulce, so there's a contraindication that you need to avoid it. If there's like bleeding skull, surgery, or especially in your case, it's contraindication like if there's a fractured of your spine, it's very careful, okay? That's contraindication. Can you stand up please? And and that's our done treatment. So how is it?
It's good. Really
Yeah.
good.
Yeah, so we'll see you in 2 weeks, and thank you so much.
You're welcome.